So during the pandemic, one technology just exploded onto the scene, didn't it? It promised to change healthcare forever. Telehealth. It was sold as this great equalizer, right? A way to get care from literally anywhere. But did this digital revolution actually deliver on that promise for everyone? Okay, let's really dig into this.
Oh man, we've all been there. You know the drill. The long waits, the travel time, having to take hours off work just for a 15-minute chat with your doctor. Telehealth was supposed to be the perfect cure for all those headaches. But as we're about to see, the real story is, well, it's a lot more complicated than that. To really get telehealth's true impact, first we have to look at the problem it was actually designed to solve, and that is the healthcare access gap. For millions and millions of people, technology was seen as the bridge that could finally span this huge divide. Now, just look at this number for a second. 81 million. That's how many people in the US live in areas with too few primary care providers. I mean, that is a staggering number. That's a massive chunk of the population facing a very real, physical barrier to just getting basic medical care. But it's not just about geography. That's only one piece of the puzzle. Experts talk about something called the social determinants of health. And what that really means is that our health is shaped by, well, everything around us: our income, our housing, transportation, even our education level. And this quote, wow, it just makes it so real, doesn't it? This comes from a study about underserved pregnant women. I mean, can you imagine trying to get to a prenatal appointment when it takes you 2 hours just to get there on a bus? That's not just a little inconvenience. That's a massive life barrier that directly hits your health.
Okay, so with these huge, real-world barriers in mind, along comes our potential hero, telehealth. The promise was pretty simple. Let's use technology to leapfrog right over these deep, long-standing problems of access.
So what is telehealth exactly? The official definition is actually pretty broad. It's not just video calls with a doctor. It's the whole shebang, from patient portals where you can see your records to text message reminders to mobile health apps. And here you can see how all those different tools could build that bridge. This table breaks it down perfectly. Video conferences, they can wipe out travel time. Patient portals, they can help you understand your own health better. Simple text messages are great for reminders. And mobile apps can connect people to vital services like WIC. I mean, on paper, it looks like a perfect solution.
And then, in 2020, this really promising technology got thrown into the ultimate, completely unplanned stress test. The COVID-19 pandemic basically forced healthcare to go virtual overnight. Just look at that number, an 845% surge in telehealth use in 1 year. Let that sink in. This wasn't some gradual shift. It was a full-blown revolution that happened in just a matter of weeks. The big test was on. But here's the twist in the story. This massive, real-world experiment didn't just show us telehealth's potential. It also uncovered a whole new and really troubling set of inequalities, a brand new digital divide. This chart tells a huge part of the story. When you look at who was actually using telehealth, you see this really clear age gap. Younger adults, those 18 to 44, used it at more than double the rate of people over 65. So the very people who often need convenient care the most were the least likely to use the new tech. And what about that core promise of helping people in rural areas? The whole reason it seemed so genius? Well, the data showed the complete opposite. People in cities were over 54% more likely to use telehealth than people in the countryside. The very tool designed to conquer distance was being used most in places that were already well connected. And the divides just kept coming. The research showed a regional gap, with the South lagging behind. It also turned out that telehealth was used way more for mental health care. And when you look globally, you see that making telehealth work isn't just about handing out phones. It requires deep cultural changes, not some one-size-fits-all tech solution. So let's zoom in from all this big data to a specific, really human story. This is about a program in Ohio called Moms to Be. They support at-risk pregnant women, and this is how they dealt with this whole new world. This quote from the program's directors just grounds you in the reality of what their clients face every single day. We're talking about women trying to navigate a healthy pregnancy on less than $1,000 a month. For them, getting access to care isn't some abstract concept. It is a daily, uphill battle. So what did they do when the pandemic hit and shut everything down? They pivoted. Big time. You can see they moved their group sessions online and then used simple, accessible tools like phone calls and text messages for one-on-one check-ins. But, and this is so important, they also knew that technology wasn't enough. They organized drive-up events to get people essential goods like food and diapers. It became this incredible mix of high-tech and high-touch support. And all of this brings us right back to our central question. Telehealth was supposed to be this great equalizer, right? A tool to finally close the gaps created by where you live and what you earn. But what if it's just not that simple?
And that right there is the telehealth paradox. The very technology designed to break down old barriers seems to have accidentally built new ones. Barriers of age, of location, and of digital access. It just proves that while technology is an amazing tool, it's not a magic wand for fixing deep societal problems. And that leaves us with this huge question for the future of healthcare. Is telehealth closing the old gap, or is it just creating a new one?